clinicians, researchers, partner institutions, and invited guests. It is a pleasure to share a few words at this inaugural lecture on behalf of the UniTwin Coordination Unit at UNESCO headquarters in Paris. First, we would like to congratulate you, Professor, and the whole team on joining UNESCO's extraordinary inter-university cooperation program, the UniTwin program, comprising around 850 UNESCO chairs and research networks in 117 countries. They work across UNESCO's wide intersectoral mandate, contributing to UNESCO's priorities, programs, and initiatives. The UniTwin program celebrated its 30th anniversary last November with an international conference on transforming knowledge for just and sustainable futures, held here in Paris. Participants recognized the value of the program's intellectual and interdisciplinary partnerships and networks spanning all world regions. It was a space for collective reflection on the future roles of science and research. Together, we need to build bridges between different domains of expertise and ensure greater transdisciplinarity and knowledge sharing for the common good. The global network is a source of hope. Whatever their specific fields of research, UNESCO chairs have a shared commitment to international cooperation, rooted in shared principles of respect for life, human dignity, and diversity. This UNESCO chair in particular will help to reinforce existing networks, notably the Global Globin network that comprises of researchers from 32 countries with the important aim of reducing the heavy burden of thalassaemia. Furthermore, this UNESCO chair will promote knowledge and capacity building in human genetics among low and middle income countries by taking thalassaemia as a model genetic disorder and thereby contributing to reducing the overall genetic disease burden and helping to advance Sustainable Development Goal 3 on health and well-being worldwide. We would like to thank the Malaysian national authorities for their support and cooperation within the UniTwin UNESCO Chairs program, and to once again congratulate the Universiti Sains Malaysia and its international partners and networks on the establishment of this UNESCO Chair. We wish you every success in your collaborative activities as a partner of UNESCO throughout the coming years. Thank you.
Thank you, Dr. K. Before we start our lecture on the in conjunction to the UNESCO Chair Award, please welcome Associate Professor Dr. Sarida Sulong, the coordinator of the Human Genome Centre, to be on stage to present the biodata for the award recipient.
Bismillahirrahmanirrahim. Thank you, Madam Chairperson. Assalamualaikum and good afternoon. The Honorable Professor Dato' Insinyur Dr. Abdurrahman Mohammed, Vice Chancellor, Universiti Sains Malaysia, together with us via online. Dr. Keith Holmes, Research Coordinator, UniTwin, representing UNESCO, together with us via online. The Honorable Professor Emerita Dr. Asma Ismail, Co-Chairman Inter-Academy Partnership, the Honorable Professor Dr. Shaharum Shamsuddin, Director Health Campus, Universiti Sains Malaysia, the Honorable Dato' Professor Dr. T. Isamuddin Ni Abdurrahman, Director Hospital, Universiti Sains Malaysia, Professor Dr. Abdul Razak Sulaiman, Dean School of Medical Sciences, Universiti Sains Malaysia, Professor Dr. Zilfalil Alwi, UNESCO Chair Award recipient, USM Top Management, invited guests, ladies and gentlemen. First of all, I would like to, on behalf of Human Genome Centre, I would like to congratulate again to Professor Zilfalil Alwi on your special appointment as the UNESCO Chair on Human Genetics of Thalassaemia, starting from November 2022 until 2026. Currently, Professor Zilfalil is a Senior Consultant Paediatrician and Clinical Geneticist at the Human Genome Centre, School of Medical Sciences on 22nd of July 1963 in Mentakak, Pahang, and he will be celebrating his 60th birthday this year. He received his specialist training in pediatrics, Master of Medicine from Universiti Sains Malaysia, and later went to study at University of Glasgow, United Kingdom, where he obtained a Master of Science in Medical Genetics, and then to University of Aston, United Kingdom, where he obtained a PhD in pharmacogenetics. His research interests includes population genomics, genetic diversity of the Malay ethnic group, and also genomic studies on thalassaemia and other diseases common to the local population. Professor Zilfalil is the founder of the Malaysian node of the Human Genome Project, MyHGP, and it has been appointed as the head of MyHGP since 2010. Currently, the Secretariat of MyHGP is located in School of Medical Sciences, USM. Ladies and gentlemen, Professor Zilfalil is also a member of the Board of Directors of Human Genome Project HGP International, now known as Global Genome, and is the Joint Chairman for Global Globing Network GGN, which is a global project by HGP which involves the systematic collection and sharing the variation data to combat hemoglobinopathies, including thalassaemia and sickle cell disease. Earlier in 2011, HGP has been involved as the official partner of UNESCO. In 2016, Professor Zilfalil has been appointed as the project leader for Global Globing Network, focusing on thalassaemia research. This represents the starting point of Professor Zilfalil's involvement in thalassaemia-related work with UNESCO. He is also a member of the Scientific Advisory Committee and the Gene or Disease-Specific Database Advisory Council of Human Genome Organization, HUGO, and the chair of the Genetic Counseling Subcommittee of the HUGO Education Committee. Professor Zilfalil has served as the director of Human Genome Centre from 2005 until 2009. He has been appointed as the chief editor of several journals, including the Malaysian Journal of Paediatric and Child Health, which is the official journal of Malaysian Paediatric Association, and also Malaysian Journal of Human Genetics, which is the official journal of the Malaysian Society of Human Genetics. Ladies and gentlemen, Professor Zilfalil is a council member of the College of Paediatrics, Academy of Medicine of Malaysia, and also a fellow of this academy. He is the advisor for the Genetic Pathology Specialty Committee of the College of Pathology's Academy of Medicine of Malaysia. He is also the founding and the current president of the Malaysian Society of Human Genetics. Besides numerous involvements with different professional societies and NGOs, Professor Zilfalil also has actively involved in postgraduate supervision. He has also published almost 200 articles in both and international journals. I have known Professor Zilfalil for almost 20 years, since my student days. Professor Zilfalil is a very positive-minded person and always looking for the opportunity for networking with both local and international partners. I am sure with this special appointment will open doors with more engagement. Thus, will highlight Universiti Sains Malaysia as the Center for Human Genetic Research, particularly in thalassaemia. Now, to find out more about Professor Zilfalil's career and his interest in thalassaemia and human genetics in general, let's watch this multimedia video presentation.
I'm delighted to congratulate my dear friend Zilfalil Alwi for his promotion to being a professor at UNESCO. Zilfalil has led the Human Genome project in Malaysia for many years, and we've worked together in the Global Genome, our UNESCO recognized charity, to promote genomic health for the whole world. Well done, Zilfalil.
When Zilfalil came to us, he was already a qualified doctor with a keen interest in clinical genetics. In contrast, our work was lab-based and data analysis. Therefore, when Zilfalil joined us, it was very much a synergy between his expertise and what we were doing. Zilfalil was a kind, generous, and hardworking collaborator. I am therefore very pleased to see that Zilfalil's career has flourished and is recognized by the award of this prestigious UNESCO Chair. Therefore, Zilfalil, many congratulations, and I wish you all the very best, you and your lovely family, for the future. Thank you.
I know Prof Zilfalil since many years ago. I met him at the Global Globin Conference and also at the Asia Pacific Conference on Human Genetics. It has been wonderful to work with him at the UGO Subcommittee for Genetic Counseling and also as a board member at Asia Pacific Society of Human Genetics. Congratulations, Prof Zilfalil, for your position as a chair of Human Genetic Thalassaemia. Sukses and selamat. Tahniah.
Zilfalil is an ambitious man. It's good to be ambitious, and to achieve greatness, you must be one. Only then you can be of benefit to others. Those who have benefited from him are his medical students, med students, master and PhD students, but not the least those who benefited the most are his patients, especially thalassemia patients. Zilfalil, congratulations.
My name is Domenico Coviello. I am an MD, PhD. I'm a director of the Laboratory of Human Genetics of Gaslini Institute. It's a pediatric research institute in Genova, Italy. It is my pleasure to congratulate with the Professor Zilfalil for his nomination, and I met him many years ago in the International Network of Thalassaemia. I had the pleasure to visit his institution in Malaysia twice, and he was visiting also our institution in Genova. I had also the opportunity to host some students from his university, and we have a good collaboration. So I again congratulate with Professor Zilfalil. Thank you very much.
First met Zilfalil as part of my participation in the HVP Global Globin Network. Since then, we have established a very strong collaboration through several international projects, including the Clean Gene Variant Curation Expert Panel and the Inherent Network. I'm really impressed by his dedication and passion to push these international efforts forward and help the thalassemia community.
Prof Zilfalil is now a leading researcher in Asia. I first met him at a seminar held in Kota Baru, Malaysia in 2003. Since then, we have been good friends and colleagues and produced several academic papers. Through collaborative studies with him, I know that he is a very motivated, energetic person. I am very much pleased to know that he will deliver a talk in an inaugural lecture as the UNESCO Chair on Human Genetics of Thalassaemia. Congratulations!
So I am honored to invite Professor Zilfalil Alwi to the stage to deliver his talk entitled Advocating Justice and Equity in Medical Genomics of Thalassaemia Through Education and Science. Please welcome Prof Zilfalil.
Bismillahirrahmanirrahim. Thank you very much, Professor Sarida. The Honorable Professor Dr. Insinyur Dr. Abdurrahman Muhammad, Vice Chancellor, Universiti Sains Malaysia, Dr. Keith Holmes, Research Coordinator, UniTwin, representing UNESCO, the Honorable Professor Emerita Dato Dr. Asma Ismail, Co-Chair, Inter-Academy Partnership, the Honorable Professor Dr. Shamsuddin Sahram Shamsuddin, Director Health Campus, Universiti Sains Malaysia, the Honorable Dato Professor Dr. Nik Ishamuddin Nik Abdul Rahman, Director, Hospital USM, Professor Dr. Abdul Razak Sulaiman, Dean, School of Medical Sciences, USM Top Management, invited guests, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh. Good morning, good afternoon, good evening, depending on where you are. And thank you for joining this inaugural lecture. Now, I'd like to begin my lecture by thanking UNESCO and UniTwin for this prestigious award of chairmanship. Now, when I started my medical career, first my housemanship at Kelang General Hospital, and later as a medical officer at Kuantan General Hospital, I was posted to the pediatric ward. It was not a posting of my choice, but the hospital director told me that I came at the wrong time and nobody wanted to be posted at the busy pediatric ward. So he had no choice. He sent me to the busy pediatric ward and had to work there. But luckily, I love children and I had a very good, a very kind boss, Dr. Liu. And he encouraged me. He guided me, encouraged me, and soon I enjoyed working in the pediatric department. So in the following year, when a delegation from USM, led by the Professor Mafauzi, they came to Kuantan General Hospital to promote USM to the medical officers. Immediately, I knew that I had to come to USM. I was interested in becoming a pediatrician. And I told my parents, I told my mother that I wanted to become a pediatrician. I decided, to join USM and to be trained there. But I will be back, back to my hometown, Kuantan. So I joined USM in 1994 as a trainee lecturer at the Department of Pediatrics. And in the following year, I went through the Masters of Medicine, the MED Pediatric Training Program. And upon completion of my pediatric training, and I became a lecturer, and I was planning to go back to my hometown. But Professor Zabidi, who at that time was the Dean of the School of Medical Sciences, he had other ideas, other plans for me. He knew I was interested in genetics, and he encouraged me to take up training in genetics and offered me a scholarship to go to the United Kingdom. So I told my parents, I've completed my training in pediatrics. Now I want to be trained in genetics. So in the year 2000, I went to Glasgow, University of Glasgow, and did my MSc in medical genetics, and continued my PhD in pharmacogenetics at the University of Aston in Birmingham. And when I returned to Malaysia, I became more active in genetic research, and gradually, became more and more involved in genetic research, and become less and less involved in my work as a pediatrician. I was lucky at that time. The Human Genome Project has just been completed, and people were very much interested to know more about DNA, to know more about our human genome. And at that time, the technology was very expensive, and the way forward was to collaborate, to work together, to pool resources, and expertise. So I had a lot of opportunities to work with many renowned geneticists from all over the world. And of course, the turning point of my career was when I was introduced to Professor Richard Cotton, who then encouraged me to join the Human Genome Project. So following the success of the Human Genome Project, Professor Cotton and a group of researchers, scientists, clinicians, geneticists, bioinformaticians, they established the Human Genome Project, which aims to collect, to collate, and to curate mutations in all the genes from all the countries in the world and for the free use by all. So with the hard work of, by Professor Richard Cotton, in 2011, HVP became an NGO official partner of UNESCO. Now, with this official recognition as a UNESCO partner, HVP was able to reach out to more researchers, more experts from around the world, especially those from low and middle income countries. Now, each researcher was encouraged to establish their own country nodes. And this is mainly to allow them, to encourage them to take an active role in ensuring that the data that they collected will be shared among the researchers within the country, or if they agree to allow sharing within those outside the countries. So Malaysia established the Malaysian node of the Human Genome Project in the year 2010, and Professor Richard Cotton came to Malaysia to officiate the launching of the Malaysian node of the Human Genome Project at Universiti Putra Malaysia near Kuala Lumpur. And since then, more country nodes were established, but unfortunately, in the year 2015, Professor Richard Cotton passed away following a massive stroke at his home in Melbourne, Australia. And with that, the world lost a great man, an icon of humanity, a man of vision, a man of plans. And following the death of Professor Richard Cotton, HVP has been administered by a newly incorporated charity, which is called the Global Variome, under Professor Sir John Byrne. And the headquarters shifted from Melbourne, Australia to Newcastle in the United Kingdom. Now, Professor Sir John Byrne expanded his board of directors to include more people from various expertise and from various parts of the world. And also, in order to streamline the activities of Global Variome, it was decided that we will focus on two major projects, two global-wide initiatives. First, the BRCA Challenge, which focuses on breast cancer, which is more prevalent in higher income countries as compared to the low and middle income countries. And the second global initiative is the Global Globin Network, or GGN, which focuses on hemoglobinopathies, including thalassaemia, which is more prevalent in low and middle income countries. So the Global Globin Network, or GGN, was designed to build capacity for genomic diagnosis and clinical services and research, and to share all the data that is generated between the 32 GGN member countries. So the focus is on low and middle income countries by strengthening education and research in human genetics of thalassaemia. So through the HVP and Global Variome link to UNESCO as an NGO official partner, GGN leverage on this link to help build capacity in low and middle income countries for responsible genetic variation data for thalassaemia and other hemoglobinopathies. Now, UNESCO, in order to advance knowledge and practice in an area that is a priority to UNESCO to itself, established a division of higher education which is called the UniTwin. And under UniTwin, it establishes the UNESCO Chairs. And there are 5 sectors of UNESCO Chair. And the chair for human genetics of thalassemia falls under the sector of natural sciences. So the UNESCO Chair program was conceived as a way to advance research, training, and program development in higher education by building networks among universities and inter-university cooperation through transfer of knowledge across border. And the UNESCO Chair of Human Genetics of Thalassemia promotes a strategy of social change by introducing ways of practicing in, leading to health prevention, health promotion, and health education in the areas of human genetics, and in particular, the area of thalassemia. So the UNESCO Chair is an appointment over the period of 4 years. And the plan is to conduct online lectures on human genetics and thalassemia, aiming for students from low and middle income countries, and designing student exchange program, which includes lab training, engaging with policymakers to make genetic diseases and thalassemia as a priority, and extending this program to other genetic diseases and rare diseases that are prevalent in low and middle income countries, and promoting the Eduvarium program as educational awareness program for community, and developing professional attachment program for visiting academics. So this will be the ongoing project for over the period of 4 years until 2026. And we hope by conducting all these activities, we will be able to help achieve the SDG 3, which is to ensure healthy lives and promote well-being for all at all ages. And by doing this, we hope to reduce the burden of genetic blood disorders through research and public health education of patients and community and at the national level, and also to build knowledge sharing and technology transfer in genetics among the low and middle income countries, and to conduct all these activities, training in technologies, education and training in technologies, to address the imbalance in skills and knowledge among the low and middle income countries, and therefore closing the so-called genomics gap. Now, genomics divide exists in low and middle income countries, and this can be attributed to the lack of resources and infrastructures, a lack of specialized staff, lack of skilled personnel, lack of networking among those in the low and middle income countries, lack of public health policy framework, and lack of awareness towards the importance of genomic medicine. And we hope we will be able to change this through a series of education and training activities. Now, the recent pandemic, COVID-19 pandemic, has revealed an imbalance in genetic resources available across the world. Some countries do not even have access to proper genetic lab to do the basic COVID-19 PCR test. So this has opened the eyes of many institutions across the world on the imbalance between the low and middle income countries and the higher income countries. Now, thalassemia, which is a common genetic disorder, is prevalent in low and middle income countries, and it has been said to pose a serious threat to those in the low and middle income countries where the health system is said to be weak. And the global burden of thalassemia is huge. If we take, for example, in Malaysia, it costs about 3 million Malaysian ringgit to treat one thalassemia major patient. And if you extrapolate this to the millions of thalassemia patients across the world, this will impose a great burden, healthcare burden, especially in those countries where the health system are weak. So the Global Network, in order to improve thalassemia care and prevention in its 32 member countries. We have divided these 32 countries into 4 categories. So category A's are those countries which have comprehensive prevention program in place and have accomplished 0 or low birth rates of thalassemia despite a high carrier prevalence. And category B countries are those countries which shows effort to establish a national control program but have limited availability or accessibility of related services for patients and its carriers. And category C are those countries which have substantial expertise in diagnosis, treatment, management, and prevention of hemoglobinopathies, but the national thalassemia birth rate is still close to that predicted by carrier rates, and more needs to be done in order to improve the healthcare. And of course, category D are those countries in which there is an overall lack of information about thalassemia carrier rates, affected birth, and prevention efforts. So Global Globin Network hopes to change and to promote improvement among these 32 member countries through a series of education as well as science and research. Now, for education, we have been promoting the Eduvarium project, which aims at increasing awareness among school children and those who are at the age of getting married, and also in order to train more people among the use of database and variant interpretation, so that they will be able to collect information and data from their own countries, and to use this data for the future treatment, future management of patients, especially during the era of precision medicine. And of course, for advocacy, we have been publishing a series of newsletters, both from the Malaysian Node and to the Global Varium, and as well as the Human Genome Organization. We have also been organizing conferences which allows networking among the researchers in these 32 member countries. And in science and research, through our partner in Cyprus, we have been promoting the use of the Ethernet portal, which comprises of a resource for clinicians and researchers dealing with hemoglobinopathies and thalassemia, providing updated information. And also to encourage these 32 member countries to use LOVD, which is a software among the largest network of curated gene databases in the world, and also to encourage the members to join Inherent, which is an international hemoglobinopathy research network with the aim of studying the role of genetic modifiers through a large multi-ethnic genome-wide association studies, aiming for at least 30,000 sample size from across the world. So in conclusion, the UNESCO Chair on Human Genetics of Thalassemia, in collaboration with the Global Globin Network, the Human Varium Project, the Global Varium, we hope to achieve equity in terms of the management of thalassemia and other hemoglobinopathies, and contribute towards the betterment of future in genetics and thalassemia, especially in the low and middle income countries. And also to help achieve the United Nations SDG 3 to ensure healthy living and promote well-being for all at all ages, and ultimately close the genomics gap and ensure justice and equity for all. Now, if you allow me for another 5 to 10 minutes, I would like to acknowledge all the people who have helped me throughout my career. And I would like to acknowledge my supervisors, Dr. Rowani, who was my supervisor during my training in pediatrics, Dr. Douglas Wilcox, who was my supervisor in Glasgow during my MSc Medical Genetics, and I had 2 great supervisors for my PhD, Professor Rosli Ismail, was my co-supervisor from Universiti Sains Malaysia, and Professor Alan Lee Wan Po, who was my main supervisor at the University of Aston in Birmingham. I'd also like to acknowledge these special people who made a change and impact in my career journey. Professor Nisho, Professor Edison Liu, Professor Richard Cotton, Chris Arnold, and of course, Professor Sir John Byrne. And today happens to be his birthday. I think he's online. Happy birthday, John. And I also like to acknowledge all my fellow board members of the Human Genome Project and also the Human Genome Organization's HUGO. And of course, I'd like to acknowledge the top management of USM, the Vice Chancellors, from Professor Tan Sri Zul, who has been very supportive. And it was during his time that USM established the Human Genome Centre. And then during Professors Dato Omar, he has helped us to establish the Secretariat for my HVP. And of course, Professor Dato Asma Ismail, who has been very supportive. Thank you, Dato, for taking your time to come to this inaugural lecture. I really appreciate it. And she has acknowledged all the contributions, all the hard work that we have done. Thank you very much, Dato. And also Professor Dato Rafiq, our immediate past Vice Chancellor. It was during his time that we applied for the UNESCO Chair, and he was very supportive. I asked him whether I should present to him the proposal, and he said, no, I have faith in you. So thank you very much, Dato. And of course, the current Vice Chancellor, Professor Dato Rahman. Thank you very much, Dato. I've known Dato Rahman. We were together in the Parents Teacher Association of the Mara Junior Science College. Later he became the Deputy Vice Chancellor, and now he became the Vice Chancellor, my boss. So I have a lot of respect for him. Thank you very much, Dato, for all your support. And I'm sure with your leadership, USM will, you will bring USM to greater heights. And I also like to acknowledge all the deans, all my deans. Professor Mahfauzi, he encouraged me to join USM. I wouldn't have been here if it's not because of him. He made a very good pitch when he visited us at Kuantan General Hospital. And then Professor Zabidi, he was a man of vision, and he encouraged me to take up genetics. And Professor Aziz Baba, Professor Sukari, and of course, special mention to Professor Saiful Bahri, the past dean. It was during his time, we submitted the proposal for the UNESCO Chair. And again, he told me he had faith in me, to lead this project. So thank you very much, Professor Saiful. And of course, the current dean, Professor Raza, my friend, my colleague, and now my boss. Thank you very much for all your support. I'd also like to acknowledge the board members of my HVP, especially two of my EXCO members, Professor Amir Faisal. Together, both of us, in the year 2010, we worked very hard to establish the Malaysian node of the Human Genome Project, and then Professor Zarina. Together, we established the Global Globin Network. So both of them passed away last year. So Al-Fatiha to them, and may Allah bless them and place them in heaven. Amen. And also like to acknowledge all my collaborators, Global Varium, the Human Genome Organization, Global Globin Network, Internet, Inherent, Asia Pacific Society of Human Genetics, Malaysian Society of Human Genetics, CleanGen, Indonesian Society of Human Genetics, which is our sister society, and also the College of Pediatrics. And thank you very much to all my colleagues at the Human Genome Centre. Thank you to the Persatuan Syndrome Down and Kelantan, the OKU Transformation Centre, Kelantan Association of Thalassaemia, Kelantan Tourist Information Centre, and our MPRC for organizing this inaugural lecture. And of course, my two generals, Halim and Ayudi, those who have worked with me I'm sure you will know Halim and Ayuni. You know, both of them manage the Secretariat of my HVP, as well as Secretariat for Global Globin Network very efficiently. I wouldn't have, GGN wouldn't have come this far if not for Halim and Ayuni. Thank you very much, Halim and Ayuni. And I acknowledge my siblings, my niece and nephews, and of course my parents. My late mother always encouraged me to live my dreams, and thank you very much for believing in me. And of course, my family, my immediate family, my wife, my children, my granddaughter, my wife, who is here, the pillar of my strength, and my son, my two lovely daughters, and my daughter-in-law, the reason of my happiness, and of course, the apple of my eye, my lovely granddaughter, Medina. You are why my world is at peace. So ladies and gentlemen, thank you very much for your attention.
Thank you, Prof, for the inspiring speech that I'm sure leave a very huge impact to everyone in the hall here today. So, Prof, please remain on the stage. We have two